The Secretary of Health and Human Services is expected to testify on Capitol Hill. A physician leader in Congress introduces budget neutrality legislation. And the White House releases their fiscal year 2027 budget proposal. For the week of April 6th, 2026. From Capitol Hill in Washington, D.C., this is Health on the Hill, brought to you by Heart Health Strategies. I'm Matt Duckworth.
Senate Appropriations Chair Susan Collins of Maine, in a statement, said the request had, quote, several shortcomings and was concerned about including significant cuts to domestic spending, adding that, quote, while the administration proposes a budget, Congress holds the power of the purse.
Kicking off this week's episode with news from the administration, where the White House released President Donald Trump's fiscal year 2027 budget request on Friday. The proposal would cut the budget for the U.S. Department of Health and Human Services by $15.8 billion, including a $5 billion or 10% reduction for the National Institutes of Health. The Centers for Disease Control and Prevention would see a nearly $4 billion or 42% funding cut. The White House proposes appropriations increases for both the Centers for Medicare and Medicaid Services and the Food and Drug Administration, a $98.2 billion or 7% boost for CMS, and an additional $232 million or 3.3% boost for FDA. Similar to fiscal year 2026, the budget document again proposes a restructuring of the department to prioritize the Make America Healthy Again agenda through the creation of the Administration for a Healthy America. The budget asserts that the new agency would save $5 billion through its consolidation of other existing programs across HHS. While the president's budget is not binding and Congress is not required to adopt its proposals, lawmakers typically use it as a guide when setting funding levels and policy priorities for federal agencies.
Debilitating disease, contaminated food, toxic environments, addiction, mental health illness affect families across every race, class, and political belief. When my team and I took the helm at HHS, we set out with clear goals. First, we aimed to make America healthy again.
That was the voice of HHS Secretary Robert F. Kennedy Jr., who's expected to testify before the House Ways and Means Committee and both the Senate Finance and Health, Education, Labor, and Pensions, or HELP committees later this month. While the hearings are unlikely to be officially noticed until 1 week prior to the events, it's been reported that the Secretary will appear before Ways and Means on April 16th and before the Senate committees on April 22nd. The hearings will focus on the fiscal year 2027 HHS budget request. Shifting to news from Capitol Hill today, where a bipartisan group of senators have sent a letter to the Centers for Medicare and Medicaid Services regarding the agency's response to Medicare Advantage overpayments stemming from upcoding. The bipartisan letter was signed by Senators Bill Cassidy, a Republican physician from Louisiana, Jeff Merkley, a Democrat from Oregon, Roger Marshall, a Republican physician from Kansas, and Tina Smith, a Democrat from Minnesota. The lawmakers expressed support for the agency's recent proposal to exclude diagnoses from unlinked chart review records from risk score calculations as part of the 2027 Medicare Advantage and Part D advance notice, but argue that diagnoses submitted through unlinked chart reviews are, quote, just one source of excess risk score growth that increases Medicare Advantage payments beyond beneficiaries' true health status, unquote. The letter outlines the steps Congress must take to, quote, truly address the persistent issue of risk score gaming and to curb abuses in coding intensity, unquote, including passage of the bipartisan No Upcode Act.
Because truth be told, we're at a deadline. We are at a crucial point as far as funding for physicians, and if not now, when are we going to get this done? So
Representative
I'm very
Greg Murphy,
optimistic.
a Republican physician from North Carolina, introduced the Provider Reimbursement Stability Act last week. The bill seeks to modernize and update the underlying mechanics of the Medicare physician fee schedule to create more certainty and stability for physicians. The legislation updates the budget neutrality threshold from $20 million to $54.3 million in 2027, and starting in 2032, indexes the new $54.3 million threshold at 5-year intervals by the cumulative percentage increase in the Medicare Economic Index applicable to physician services for each year of the preceding 5-year period. The legislation also establishes a corrections mechanism related to estimated utilization of codes, provides updates at minimum every 5 years to direct costs used to calculate practice expense relative value units, and limits the annual budget neutrality adjustment to the conversion factor to 2.5%, starting in 2027. 35 House Democrats wrote to the Appropriations Committee leadership urging they block implementation of the Wasteful and Inappropriate Service Reduction, or WISER model, quote, or any related model that would introduce prior authorization into traditional Medicare, unquote. The lawmakers argue that the model, which expands Medicare's use of prior authorization and artificial intelligence to determine medical necessity, could be used to deny coverage for beneficiaries in traditional Medicare. The letter, which was led by Representative Susan DelBene, a Democrat from Washington, asks the committee to include language prohibiting implementation of the model in the fiscal year 2027 appropriations legislation. The letter reads, quote, while prior authorization is often described as a cost containment strategy, in practice, it increases provider burden, takes time away from patients, limits patients' access to life-saving care, and creates unnecessary administrative burden. It goes on to say, quote, many patients choose traditional Medicare because they know their care will be determined by their doctors and not by insurance companies, unquote.
In Vermont, literally today, people are receiving information that there will be a doubling or in some cases a quadrupling, 4 times increase in their health insurance premiums. And this is on top of the fact that 15 million people are being currently...
Final news today were Senate Finance Committee Ranking Member Ron Wyden, a Democrat from Oregon, and Senate Help Committee Ranking Member Bernie Sanders, an independent from Vermont who caucuses with Senate Democrats, are urging their respective committee chairmen to hold hearings with the CEOs of the nation's largest health insurance companies. The lawmakers contrast the $54 billion in profits made by the 7 major health insurance companies in the United States with the more than 85 million Americans who are uninsured or underinsured, and the over 500,000 people facing bankruptcy due to medical debt. They also express concerns with the consolidation and vertical integration taking place across the health insurance industry. The senators write, quote, the American public deserves to know why the big insurance executives that testified before the House earlier this year continue to get richer and richer, while over 1/3 of people with health insurance have been forced to skip or delay getting the care they need because of the outrageous cost, unquote.
Good morning and welcome everyone to the organizational meeting for the 119th Congress.
And I welcome everyone to the first Help Committee meeting of the 119th Congress.
Good morning and welcome everyone to the first meeting of the House Committee on Energy and Commerce of the 119th Congress.
The Finance Committee will continue its long tradition of addressing these matters in a manner that invites bipartisanship.
We end each week's episode with the Call to Order, where we lightning round congressional meetings and hearings in the near future that you need to know about. The first and only health-related event currently on the calendar will occur on Tuesday, April 14th at 10 a.m. when the Senate Commerce, Science, and Transportation Committee holds an executive session to consider several bills, including the Stop the Scroll Act, the Mental Health and Aviation Act, and the No Fentanyl on Social Media Act. Thanks again for tuning into this week's episode of Health on the Hill, brought to you by Heart Health Strategies. For more information on this week's healthcare happenings in the administration and on Capitol Hill, you can visit our website at hhs.com and click on the news section at the top of the page. You can subscribe anywhere you get your podcasts, including Apple Podcasts, Spotify, YouTube, and SoundCloud. Did we miss a story you wanted to hear this week? If so, email me at mduckworth@hhs.com, and we may include it in our next episode. Have a great week, and stay healthy.